Good afternoon, everyone. I hope you are all doing well. Thank you for joining today's class. My name is Nomita. We are going to learn an important MCQ for the Cushing syndrome. So let's before we begin, make sure you have your notebook and the pen. Stay with me till the end. So let's start. So whenever the body experiences distress, such as the infection, trauma, or the surgery, it releases a stress hormone called the cortisol. So, but the adrenal gland does not release the cortisol on its own. The brain control is through a pathway called the AIIMS. So this pathway involves the hypothalamus. Then pituitary gland, and adrenal gland. So now let us see how these organs communicate step by step to produce the cortisol. So when the body experiences distress, infections, trauma, or the low blood glucose, the first signal begins in the hypothalamus. So when the body experiences the stress, infection, trauma, low blood glucose, the hypothalamus releases a hormone called the TRH hormone. So this TRH hormone tells the pituitary gland to release the ACTH hormone. So this ACTH travels to the blood to the adrenal gland. Mainly acts on the middle layer of the adrenal gland called as the zona fasciculata. And ACTH, adrenocorticotropin releasing hormone, reaches the adrenal cortex and instructs it to release the cortisol. So once they release cortisol enters the bloodstream. Okay, cortisol enters the bloodstream and produces its effect. Okay, and it produces its effect by increasing blood sugar. By increasing the blood sugar, then helps the body cope with the stress, and it also helps to maintain the helps to maintain the blood pressure. So when the cortisol becomes high, it sends a signal back to the brain. It inhibits both the hypothalamus and the pituitary gland. Okay, so this prevents the excess cortisol production. So the HPA axis works like a command chain. Okay, so the hypothalamus sends a signal to the pituitary gland and release the ACTH hormone. So this ACTH hormone ACTH stimulates the adrenal cortex, and finally the adrenal gland release the cortisol. Now we understood how the hypothalamus, pituitary, and the adrenal glands communicate to produce the cortisol to the HPA exit. So now imagine what will happen if the cortisol is produced in excessive amount. That condition is called as the Cushing syndrome. So what happens in the Cushing syndrome? It happens when one hormone becomes too much in our body, we will say imbalance, problem, or illness. So Cushing syndrome happens when the body has too much cortisol for a long time. So when it increases excessively, either due to the long-term steroid medications or due to the problems in the pituitary gland, due to the long-term steroid medication, and either due to the problems in adrenal and pituitary gland, the body shows the classic symptoms. And students should remember, little cortisol is good, but too much cortisol is like a slow poison. Why? It is called as a slow poison because it increases the fat. Okay, it increases the fat, and it increases the sugar. It increases the fat and it increases the sugar, and it also has to weaken the bone and lower immunity. So cortisol also has a diurnal variation. So what do you understand by diurnal variation? Just like our energy level. So our energy level starts in the morning and tired at night. So similarly, cortisol peaks in the morning and lowest at the night. So that is why the cortisol tests are done in the specific time. So our brain is a biological clock. So the cortisol hormone secretions according to the day and the night, that is called as diurnal variation. And the patient has in the Cushing syndrome. In the Cushing syndrome, the body has the excess cortisol, so many body systems are affected. So the patients develop moon face means the round or puffy face, and buffalo hump, the fat deposition on the back of the neck, and then frontal obesity. So fat deposition around the abdomen with the thin arm and less easy breathing. Then mood changes can occur. Then immunity becomes weak. And muscle weakness, especially proximal muscle. So these changes occur because the cortisol affects the protein, fat, carbohydrates, and the metabolism. So early recognition and the proper treatment is very necessary, very important. If untreated Cushing syndromes can lead to severe complications like infections, cardiovascular disease, and diabetes. So now let us see how these concepts are asked in the NORCET or NCLEX type questions. The first question we have, which condition is characterized by an overproduction of the cortisol by the adrenal glands, often resulting from the prolonged exposure to the stress? This condition is characterized by an overproduction of cortisol by the adrenal glands, often resulting from the prolonged exposure to the stress. So, the question says this condition occurs due to an overproduction of cortisol from the adrenal glands, uh, often associated with the prolonged stress. The answer will be Cushing syndrome. So, in Cushing syndrome, what happens in the Cushing syndrome? The Cushing syndrome is characterized by the overproduction of the cortisol by the adrenal glands, and the cortisol increases during the stress. So if the stress continues for a long time, the adrenal glands keep producing the cortisol continuously. Then other options are wrong. The first one is the hypothyroidism. So hypothyroidism, which is caused by hypothyroidism, which is hypothyroidism, which is caused by the low levels of T3 and the T4. So, not from the thyroid gland, not the cortisol. And the second option is the hypothyroidism. Hypothyroidism, which is caused by the excess thyroid gland, mainly affecting the metabolism, but it is not unrelated to the cortisol. And addition disease is opposite conditions if there is a deficiency of the cortisol. Okay, so among these options, the correct answer is the Cushing syndrome. The next question we have, which hormone is responsible for the body response to the stress, including the fight or the flight response? So, which hormone helps the body react quickly during the stress? So which hormone is, next question we have, which hormone is responsible for the body response to the stress, including the fight or the flight response? So which hormone has the body react quickly during the stress? So during the stress, the body releases many hormones, right? So during the stress, the body releases many hormones, so adrenaline acts immediately. But if the adrenaline is not an option, the next major stress hormone is the cortisol. So cortisol is a long-term stress hormone. It has the cope with the stress. It has the cope with the stress by increasing the blood sugar, increasing the energy, and preparing the body to handle the stress. And supporting the fight and the flight response. So that is why among the options cortisol is the correct answer. So why others are wrong? Thyroxine. Okay. So thyroxine controls the body metabolism. Thyroxine controls the body metabolism, not the stress response. And prolactin. Prolactin is to stimulate the milk production. Okay. So prolactin is to stimulate the milk production, and insulin is to lower the blood glucose level. So among the options, the correct answer is the cortisol. So cortisol is the hormone that regulates the body response to stress and plays a key role in the fight or the flight response. And next questions we have. A nurse is caring for a client with a diagnosis of Cushing syndrome. What is the most common cause of Cushing syndrome that the nurse should consider before assessing this client for the psychological, physiological response? So the question says, what is the common internal cause of the Cushing syndrome? Okay, so not talking about the steroid medicines here, they are asking about the body on causes. Okay, so the correct answer will be hyperplasia of the adrenal cortex. Hyperplasia of the adrenal cortex. So means the adrenal glands hyperplasia of the adrenal cortex means the adrenal glands become bigger and produces too much cortisol. This leads to increase the cortisol. So at all the time of the Cushing syndrome, this is the common internal mechanism of the Cushing syndrome. So what other options are wrong? The first one is option A is primary hypoplasia. So primary hyperplasia, hypoplasia means the underdeveloped, right? Hypoplasia means the underdeveloped, causing the low cortisol seen in addition disease. And the second option is the third option C is deprivation of the adrenocortical hormone. So deprivation means what? Deprivation means the low level. Okay. So low level causing the low level of the cortisol. So that means lack of the cortisol, not the excess. Okay. And third option B is insufficient adrenocorticotropic hormone production. So low adrenocorticotropic hormone causing the low cortisol, ACTH causing the again leads to addition disease. Again leads to addition disease, not the Cushing syndrome. So among the options, the correct answer is hyperplasia of the adrenal cortex. The next question we have, which clinical findings should the nurse expect in the patients with Cushing syndrome? So the correct answer will be moon face and buffalo hump. These are the classic physical signs caused by the abnormal fat distribution, okay, due to the excess cortisol. So other options are incorrect or incorrect. The first option is hypoglycemia. So in Cushing syndrome, there is the hyperglycemia, not the hypoglycemia, because the cortisol increases the blood glucose. And the second option is the weight loss. So patients usually have the weight gain, especially in the abdomen and the face. And last one is the decreased blood pressure. So cortisol increases sodium and the water retention, leading to the hypertension, not the hypotension. So the correct answer is moon face and buffalo hump. A nurse is caring for a client who is scheduled for a bilateral adrenalectomy. So which medication should the nurse expect to be prescribed for this client on the day of surgery and the immediate post-operative period? So the question says if both adrenal glands are removed, so which medicine must be given on the day of surgery and right after the surgery? So the correct answer is hydrocortisone succinate. So after the bilateral adrenalectomy, the body cannot make the cortisol. Okay, so if cortisol is the life-saving hormone, right? So without it, patients can go into the adrenal crisis. So since both the adrenal glands are removed, cortisol levels drop to 0. So we must give hydrocortisone immediately to prevent shock. While other options are wrong, the first option is methimazole. Okay, methimazole used for the hyperthyroidism. Okay, used for the hyperthyroidism, not related to the adrenal gland. And then second one is the pituitary express. So rarely used, not a treatment for adrenalectomy. Okay, and the third option is regular insulin. So it is used for the diabetes. The correct option is hydrocortisone succinate. The next questions we have, the nurse is reviewing the laboratory results for a client with the Cushing syndrome. So which finding is expected? Okay, so the correct answer is sodium 150 milliequivalent per liter. So the normal sodium level is 135 to 145 equivalent per liter, right? So the normal sodium level is 135 to 145 to 145 milliequivalent per liter. So if the sodium level is is more than 145 milliequivalent per liter or 150 milliequivalent per liter, so it indicates the hypernatremia. Okay, so it indicates the hypernatremia, and excess cortisol causes the sodium retention and the water retention. So this is an expected finding. Okay, and the second, and why other options are wrong? The first one is the potassium. Okay, so potassium 5.6 milliequivalent per liter. Potassium 5.6 milliequivalent per liter. Normal potassium level in the blood. Normal potassium level in the blood is 3.5 to 5 milliequivalent per liter. So if the potassium level is more than 5.6 milliequivalent per liter, it indicates the hyperkalemia. Okay, it indicates the hyperkalemia. So in Cushing syndrome, potassium is lost in the urine, so the patients develop hypokalemia, not hyperkalemia. Okay, and the third option C is calcium 12 mg per dl. So the normal calcium level is 8.5 to 10.5 mg per dl. So if the calcium level is more than 12 mg per more than 10.5 mg per dl or 12 mg per dl, it indicates the hypercalcemia. Okay, so hypercalcemia. So Cushing syndrome is more associated with the bone resorption. Okay, Cushing syndrome is more associated with the bone resorption and osteoporosis. But calcium to 12 mg per dl, it indicates the hypercalcemia. It is not a typical expected finding. And the last option, that is glucose 60 mg per dl. Okay, so the normal glucose level in the blood is 70 to 140 mg per dl. So if the glucose level is less than 60 or 60, it indicates the hypoglycemia. So in Cushing syndrome, cortisol increases gluconeogenesis. Okay, in Cushing syndrome, cortisol increases the gluconeogenesis, causing the hyperglycemia. Okay, hyperglycemia, not the low glucose. So the correct option is sodium 150 milliequivalent per liter, because the excess cortisol causes the sodium retention and the water retention. So this is an expected finding. Next questions we have, which nursing priority is the most important for a patient with Cushing syndrome? Which nursing priority is the most important for a patient with Cushing syndrome. Okay, so the correct answer is preventing the infection. The correct answer is preventing the infections. Okay, so high cortisol causes the immunosuppression. Okay, and the patients have decreased inflammatory response. And therefore wound healing. So even the minor infections can become the severe. So therefore, infection prevention is the most priority. Okay, it's the most priority. So why other options are wrong? Encouraging the fluid intake. Encouraging the fluid intake. Patients with Cushing syndrome. Patients with Cushing syndrome usually have sodium and the water retention, right? So sodium and the water retention and edema, not the dehydration. Okay, so not the dehydration. So fluid intake is not the main priority. And the third option is promoting the weight loss. Patients usually have, in Cushing syndrome, patients usually have weight gain, moon face, frontal obesity occurs. Okay, so this is not an immediate priority as compared to the infection rate. And the last option is increasing the activity. So patients often have muscle weakness and the fatigue. Activity may be encouraged. Okay, activity may be encouraged gradually, but it is not the priority problem. Next question we have. A patient with Cushing syndrome is at high risk for which complication? So, next question we have. A patient with Cushing syndrome is at high risk for which complication? So, after adrenalectomy, the body cannot make the cortisol, right? The risk not make the cortisol, and patients can go into the adrenal crisis or adrenal insufficiency. So we have to monitor the hypotension. Okay, so the other options are wrong. The first option is infection. So second option is the hypoglycemia. Hypoglycemia occurs with hypoglycemia, and in Cushing syndrome, there is the hyperglycemia, not the hypoglycemia, because with excess cortisol, in Cushing syndrome, there is the hyperglycemia, not the hypoglycemia. Okay, so it occurs with the excess steroids or the steroids, and then sodium retention. Okay, and next one is the weight loss. So the correct answer will be the hypotension. Cortisol suppress the immune system and increase the infection risk. Blood pressure and glucose increase, not the decrease. So after adrenalectomy, for Cushing syndrome with finding requires the immediate intervention. So the correct answer will be low blood pressure. So low blood pressure after the adrenal renal surgery, the acute adrenal insufficiency is a life-threatening emergency. So okay everyone, we will stop here for today. Remaining MCQ we will discuss in the next class. Thank you. Let's talk about the